Hello and welcome to SimCast, the higher education simulation podcast. My name's Lawrence Hill and I'm joined by my regular co-host, Mr. Tony Jermy.
Hello everyone, welcome back to SimCast. Glad you could be with us.
And a very warm welcome as well to Helen Needham. Helen, welcome to SimCast.
Thank you, hi.
So Helen is a learning disability nurse with over 40 years experience across community and clinical settings, including therapeutic interventions, counselling support and end-of-life care. She's now an academic at Birmingham City University, leading simulated patient learning and undertaking a professional doctorate exploring student nurses' experiences of breaking bad news within simulated learning disability contexts. Fascinating work, Helen. We're going to dig right into that today.
Yeah.
So, we should also say that we met at a conference in
which seems to be a recurring theme, doesn't it? We met at HPSN last year.
December. Last year.
We've tapped a little gold mine of people to come onto the podcast, and you were one of them. And Steph, who was on last week's episode or the last episode, you work quite closely together.
We used to work together at the same university, so we've done quite a lot of simulation work together. So been involved in quite a lot of innovative work together. Across that.
That's the key. That's the word, innovative, when it comes to simulation, which is one of the reasons that we've invited both of you to get onto the podcast.
Yeah.
So let's start off by, and this is a question that we ask all of our guests, is, it's easy to talk about what you do, but why do you do what you do? What gets you out of bed in the morning? What makes your heart sing when it comes to the work that you're doing with simulation?
Yeah, sure. I mean, it's not the main role, unfortunately, in my current position at Birmingham City University. I'm part of a module team across core module. So simulation is only a small part of what I do. But for me, the simulation part of what I do is what excites me. That gives me that passion. Because working with a group of students to actually give them that support to practice, immerse, interact with somebody in a simulation setting, knowing that that's helping their learning journey, really sort of, you can both tangibly see their growth within a couple of hours, but also that is really powerful in terms of they're going to apply that when they go and work with real people. And that for me is really what gets me out of bed in the morning.
So it's not the module organising and all of the admin and stuff that you have to do.
It's not Outlook. Outlook's not your favourite thing about working in universities.
My 7,000 emails that I've still got to go through.
We've both been course directors and had other, administrative roles and tasks within our jobs. So we know exactly where you're coming from with that one.
Sure.
Yeah. So one of the focuses of the simulation work you do with nurses is around learning disability, and this is obviously, this is why we wanted to get you on, because we've not had anyone come on SimCast before and talk about the unique challenges of facilitating simulation in a learning disability nursing context. And I just wondered, in that unique kind of environment, what do you do to establish the psychological safety of your learners when coming into those kinds of simulated experiences?
Yeah, sure. I think the psychological, the emotional safety for me is one of the really high top priorities. I think, my sort of basis in life is very much about well-being, making sure people feel supported. So from the simulation point of view, I think it's really important that the students feel that this is a safe space. It's a safe place that they can come, they work with their peers, they get supported by academics who obviously have experience in simulation, and they're able to explore and have a go at, have a try out in terms of how that conversation might go with somebody. Obviously we're working in the context of, if you like, sort of people who may have cognitive impairments. That obviously does include learning disability, but making it transferable for other fields, in terms of, we may not meet somebody with a learning disability, but you may meet somebody who is in pain, who's got infection, who is maybe a little bit delirious because of that, or has some form of dementia. So there's all sorts of reasons why people's cognitive functioning may be impaired in healthcare. And I would probably suggest that most patients who are in healthcare probably have some level of cognitive impairment while they're in that healthcare facility. So preparing the students to actually recognise this is a safe space. We're not there to set them up. We're not there to make them fail or make them look stupid. This is about giving them a safe space. So that's very much part of that introduction, really. So that's the psychological safety, I think, is about saying it's about, we will work with you, and we're not here to make you look stupid.
So Helen, doing simulation around topics around learning disability must be quite challenging to get it right and get it authentic. So what do you do? How do you design a simulation based around such a complex topic?
Sure. And I think that probably has been the complexity over the last sort of probably 10 to 15 years, really, in terms of how do we make this authentic? We don't want it to be tokenistic. You know, it really needs to reflect how people with learning disabilities may, experience that healthcare setting. So I think the important thing is to really sort of think about people that we know in real life, some of the experiences they've had, and replicate that somewhat. We're really fortunate that the simulated patients that we work with have all got some experience of either working with or knowing somebody with learning disabilities. So they're able to draw on some of their own personal experience from being with and observing how people interact. And then obviously the academics, we've all worked in learning disability services for a long time, known a lot of people with learning disabilities and their families. And so we try and generate the scenarios based around people that we've known and the responses that people have given.
It's a delicate line to tread, isn't it? When you're looking at trying to recreate that
really is, and I think I'm always really mindful, and I'm really fortunate that the simulated patients that we work with also don't want to feel like they're patronising or actually not giving the real authentic responses that could happen. We're not going to get it 100% right, I know that. Ideally, we would love people with learning disabilities to be part of our simulation team. I think that's probably a little bit in the future, particularly in around topics around breaking bad news, because I think ethically that is going to be so difficult to even contemplate.
Yeah, and we're definitely going to dig deep into that in a bit, because I think that's the kind of one of the core tensions I think for me in this topic. So talk to us a little bit more about the kind of the setup of the simulations. So you said they're informed by experiences, but that you use simulated patients, and you don't actually use people with learning disabilities in those simulations, and we'll get into the ethics of why a bit later.
Sure.
So how talk to us a little bit more about the design and about the overall feel.
I mean, particularly I think for the Breaking Bad News simulation, obviously that has to be done really sensitively, and I think this bolts on to previous work that I've done, and with my colleagues we've actually built up scenarios with simulated patients around people with learning disabilities and their healthcare needs, to really have that impact for students in terms of what could happen for somebody in a healthcare facility, whether that be a GP practice or a hospital setting. And I think, we've drawn on our clinical experience in terms of people that we've worked with, people that we've known. And I think that has then helped us to sort of design and work with our simulated patients to how they respond to those interactions that students have. We're really fortunate that we've actually got a group of simulated patients that have worked with us for probably 20 years, some of them, who have actually been able to develop those, if you like, those scenarios, develop the characteristics, and almost really embed that person with a learning disability into another persona, if you like, when they come and do the work with us as simulated patients.
So there's a layer of reliability there, isn't there, with working with those individuals?
Yeah.
We've talked in the past about simulated patients or confederates going rogue when they go off script a little bit, and how challenging that can be. And I would imagine in this situation it's even more challenging if that happens.
Yes, it certainly can be.
So I'm a paramedic by background, and I think when people talk about breaking bad news, euphemistically for me that always means telling a family member but that the resuscitation attempt is failing or has failed. So can you give us some more explicit examples of the kinds of breaking bad news simulations that you run?
Sure. I think when we look at literature, we always know that breaking bad news historically was around death and dying. I think we now know that obviously newer definitions have come out in terms of it not just being about death and dying, but more about anything that has a detrimental impact on someone's life. I think when we talk a sort of breaking bad news to people with learning disabilities, that becomes a wider topic. For people with learning disabilities, those sort of scenarios could well be about having a diagnosis of maybe poor health that maybe would impact But maybe even being told they can't go out on the day that they've got planned. You've got a day out planned. Member of staff phones in sick. Unfortunately, that day trip has to be cancelled. That can be quite a major piece of news for somebody who's actually been planning that day out for some time. I mean, I think we could go on looking at all those sort of different scenarios. I mean, I use one.
No, but that's so
Yeah.
good. Thank you, because that for me kind of speaks to the. This isn't about the big bang events. This is about the routine, everyday challenges.
Yeah. And I think I talk about things. I mean, I make a comment a lot of times to students in terms of if you sometimes say to somebody with a learning disability who maybe their sole focus is what's for tea, and you change the menu, and you actually take that chocolate cake off the menu, that could actually have a really detrimental effect in terms of their response, how they react to that news. So essentially, I guess, as learning disability nurses and working with people with learning disabilities, most conversations could be deemed as bad news.
The little things are the big things for
Absolutely.
everyone, but particularly perhaps in different contexts like the one you describe.
Sure.
That's so interesting.
On the last episode, we were talking with Steph about the importance of using simulation for developing those non-technical skills or those soft skills, those interpersonal skills.
Sure.
And I'm guessing, again, in this specific remit, this is one of the areas where it's most important.
Yeah, it's
right?
massive. That building that relationship with you build that relationship with the person to start with, and I always talk about a connection. Until you've got a connection with somebody, it's really difficult to do any healthcare intervention. And that's the one thing that we do on the other simulations that we offer, particularly to our first year students, is it's a topic, and it's just called communication with somebody with a cognitive impairment. And we always say, once you've got a connection with somebody, and we put things into the scenarios like little props for them to look at, so they can start a conversation. Like somebody might wear a bright cardigan,
nice.
or somebody might have a particular bag in front of them, so they can start that conversation. Until they've got that connection, they're not going to get anywhere. So yes, absolutely.
And you're primarily dealing with undergraduate nursing students. Is that the target audience for your simulations?
Predominantly, yes. I mean, I do some of the simulations in a similar context with post-reg, so practice nurses, district nurses, also some of the post-reg people that come on the end-of-life module. So we do a similar thing for them.
So that's interesting. So what do your different learner groups, is there any sort of common themes in terms of what they find most challenging?
I think the thing that most students find challenging is being watched by other people. I think the first thing they say is, we're doing simulation, we're going to be watched by other people.
So it's the simulation rather than the content within the simulation.
Absolutely, it tends to be the context of simulation and being watched. I think then it's almost like that we've not worked with people with learning disabilities, or we have, but we don't want to do it in this setting. So it really is about encouraging, being really positive, really sort of building that confidence that actually we're just offering you something to help you learn and explore.
And when you say watch, do you what's the setup that you use? Do you have the simulation taking place in one room, people watching remotely, or is everyone in the same space together?
Fortunately, within the learning disability context, we're able to have people all in the same environment, and that's probably one challenge in terms of cost, because we have everybody in the same room, and obviously they would be very, very small groups. I like to think that certainly between 6 and 8 people is more than enough to be in a small room with a couple of people doing an interaction, the rest observing, and maybe time out if needed to have discussions, but to actually allow that to flow. That is probably enough people in a room.
I'm really interested in something that's in your bio about you being having a background in counselling. I'm just, it might be a difficult thing for you to, I suppose, reflect on, but how do you think your experience as a counsellor influences your facilitation of simulation?
Yeah, sure. I think that was something I sort of reflected on the last couple of days while I've been preparing for this. I trained as a learning disability nurse over 40 years ago, and then there was no graduate training at that point, so I sort of stepped into doing lots of diplomas, and I was never really that interested in, if you like, challenging behaviour, forensic type work, but I was really interested in how I connect with people with learning disabilities, particularly when they've had difficult situations. We've worked with a lot of people who seem to, have lost a significant person from their life, So I went off and did a counselling diploma, and started to apply that, if you like, to my work base and working with people with learning disabilities. And I think those skills of being able to see the person and actually connect with that person at that therapeutic level. Person-centeredness really comes through in learning disability nursing anyway, but it comes across in counselling, and certainly Roger's counselling and person-centered counselling was really what I favoured. So I really got to, to actually stand next to that person and really look at what was happening for them in their life. So I think that's really then really important when I look at doing simulation, of actually being encouraging, supportive and positive with the students, but actually allowing them to be where they're at in that simulation experience. I'm not expecting them to be anything different than what they are, but I'm offering them something they can learn from, increase their self-awareness and confidence.
I'm not expecting them to be anything they're not. I'm just offering them an environment that they can learn in. Exactly that. Like that's perfect, isn't it?
Helen, did you do any sim when you were training as a counsellor?
I did. Well, not particularly sim as such, but there was hours and hours of practice interaction, if you like, in the courses. So obviously, whenever we were at college doing the course, a 3-hour session, we would probably be doing 2 hours of interaction with another person, with observers. So I guess that essentially would be sim, wouldn't it? In a sense,
skills and drills.
I think it probably wasn't set up as a simulation at the time, and I think when you asked me, I was thinking, I don't think I did, but in essence, yes, I think that probably would now be similar to simulation as we would see it now.
Yeah, it feels like, because of the skill sets required to do this well, it feels like simulation is almost non-negotiable, right? In terms of learning and development with this. But it'd be interesting to see how many centres around the country or globally are looking at this area in detail when it comes to simulation, because it's I think the word that's recurring all the way through in my mind is challenging.
Oh God, yeah. But I also think that, and I've thought this many times, that we choose as healthcare educators about how we set our programs up, and simulation can feel really, I mean, we're singing to the choir here in terms of the people listening to this. People acknowledge the value of it, but I actually, more and more, I think actually we're morally obliged. This isn't something that we're doing because we're just passionate simulation educators. I think at a deep level, what we're saying is this is critical. This isn't, this is absolutely necessary for individual learners and for the people they look after. There's a moral obligation to do this stuff so that there is an element of rehearsal that helps patients and that helps individuals manage those challenging situations that they are inevitably going to encounter.
Absolutely.
So, and talking of that, you're currently undertaking a professional doctorate, exploring the perceptions and experience of breaking bad news in a simulated environment for nurses.
I'm looking at the learning disability student nurses' experiences of breaking bad news to people with learning disabilities, but by using simulated patients.
Amazing. And can you tell us about the kind of emerging themes that are coming from your research?
I think there's some emerging themes around definition of what breaking bad news is, which I'm obviously going to be looking at in some more depth. I think the other things coming out are really how the students really like the opportunity to practice, and they recognise that it's not a skill that they practice in their placements, their clinical practice, because it's done by qualified nurses or it's not done at all. So I think that the opportunity that they get, they're really grateful for that opportunity. The emotional responses to actually seeing it on their timetable and actually having this introduced at the beginning of the module, I think how people respond emotionally to this type of topic has really been fascinating, and there's been emotions of really being excited and anticipation of what's going to happen, but also some real anxiety and some real nervousness about what's going to happen. And of course, people, when they're looking at breaking bad news, there is going to be some potential emotional triggers into their own personal life as well, and experiences they've already had in life. So being really mindful of that as well. and certainly some of the students have been really honest about how it affected them personally after they'd had the workshop. So those seem to be the things that are coming out, and there is a few other things I think that will draw out. I'm sort of, I'd like to think I'm 90% through my data analysis. I'm probably not quite 90%, but I'm just certainly working, and the things are being constantly refined.
Yeah, great. That sounds fascinating. We're gonna have to get you back and to hear more about the sort of the final analysis at some point. My own research into paramedics related to identity and how the experiences they have shape the people that they become, that we become. I wonder what doing this simulation means for student nurses' identity as learning disabilities nurses. It must feel quite profound for them. It must feel very real and very necessary.
Yeah, sure.
What do they say about how it shapes how they practice?
Yeah, no, sure. I mean, there's a couple of really key quotes in terms of, I actually told somebody their mum had died, and that was a quote that came out, and that felt really real because it was something that they'd actually done in simulation. What I found was that some of the students actually had felt more confident once they'd done the workshop to actually go out and say to their practice assessors and supervisors, can we go and actually have these conversations with people for real, and felt a lot more confident doing it. And I think when we look at the role of
maybe starting with chocolate cake and working up to death of a parent.
I think the other thing, you asked me what surprised me, I think the other thing that probably surprised me is that the majority of the students that participated in the research said they hadn't had experience of breaking bad news. But actually, when I actually looked at some of the things that they talked about and what they had experience of doing, in essence, I think they had experience of breaking bad news. They just hadn't talked to somebody around death and dying. So I think, in essence, a lot of them probably had already had those experiences. And when we look at the role of the learning disability nurse, these are everyday conversations. When you're working with somebody with a learning disability, these sort of conversations are going to be everyday conversations.
But how much more mindful is that going to make practitioners, like to say, look, that bit where you said, actually can't go to the thing tomorrow because of staff line, that was really significant. And that, what a great, vehicle for raising learners' understanding of how, the tremendous power that we have when we communicate with people to impact on them in a negative way because we give them something they perceive as bad news. That's as the raising of self-awareness about how what feels just like normal conversation is actually tremendously heavy news for another person that's a fantastic insight.
And it's thinking about how do you then, I guess, support your staff in recognising that on a day-to-day basis. I was thinking about this the other day. I mean, when I was first training, they gave us an extra financial contribution in our salary because we work with people with learning disabilities, and I think mental health nurses had it as well. Obviously, we don't get that now, but I think it was recognised at that point, sort of the difficulty that comes with supporting people with learning disabilities. Those extra both extra skills, but extra burden, I guess, in terms of what you're doing on a day-to-day basis.
How do you temper that difficulty with your learners when you do this sim? So presumably you have a package of different simulations that you run. Do you scaffold it? Do you build the complexity as you go along? You talked about potentially being triggered, learners being triggered in the sim. So how do you support those learners because you're dealing with such challenging topics?
I mean, ideally, I'm not trying to dodge the question, but ideally, I would like more sim to be built in across the 3 years, so they start off with it being quite low key. Absolutely. I mean, this is offered in their final year, so obviously by then, I'm hopeful that they have done at least some simulation throughout their course, but probably not in learning disabilities, but more generic across the course.
So, is this when it comes to your module?
So it comes into.
When you've got more say so.
It's not my module, actually. I work alongside a colleague. So it comes into third year or fourth year if they're doing the MSci programme. So it comes into their last year, and part of that then is about giving them some preparation as part of the module introduction, that they will be covering some quite complex healthcare issues as part of that module. And part of the module, they're going to be doing some simulation around breaking bad news. So that is introduced at the beginning of the module. We then send out quite a lot of information in terms of what the simulation is, why it's really useful. It's a safe space. And part of that is we also then give them one of the scenarios so they can start to prepare in terms of what they might do.
Nice.
And this has been a bit of a shift from what we did in the initial stages when this workshop was first devised. And that's obviously from feedback from students. They want all the information, but actually that's not always real. Because sometimes you are going to go to work and going to need to break bad news to somebody without preparation. So we give them some information, but we don't give them a lot in terms of the other scenario. And then we bring them in on the morning. We all meet in a room. We suggest they get coffee and they come in and they sort of talk to each other. And then again we'll go through setting the scene of what the day is going to look like, as you would with any sort of simulation workshops. We talk very much around signposting. We talk very much about needing to take time out if they need to. That is absolutely fine. And we really stress that importance of looking after themselves, but also each other, because I think that is so important. And then I'll do a very short mindfulness meditation with them, just to settle, which is
It sounds really
quite interesting.
It sounds really interesting. Yeah. So you're trying to maximise the resources that you've got, but within the constraints of I'm guessing quite a full program with competing priorities and resources. And I think that really resonates with me with various different programs and for we've been in the past. And I think unless you've got that simulation which has been embedded from the ground up, right from curriculum design. But even then, I still think you've got competing priorities.
Yeah, absolutely. I mean, timetabling is always an issue. Ideally, it would fall over a whole week. In my eyes, I'd love to see this as a whole week simulation where you do that preparation. You introduce, so you get to form that connection relationship with the simulated patient, and then you explore how you're going to go and do it as you would in clinical practice. You wouldn't just just jump into it, but we have to explain that obviously this is it is being set up to replicate and give them a learning experience. But timetabling is always an issue because ideally, a day would be ideal, but then they put it into two-hour sessions with a break in the middle. And then we have to try and encourage students to think about, well, could we just work through that break, but with other breaks, because 2 hours and then a break doesn't really seem to fit within this type of work.
No.
So there are those contextual challenges
that
are actually quite difficult at times. And unfortunately, you can't get timetabling people to understand that.
I mean, we're all guilty of it, just trying to get the work in and the job done, aren't we? We talk about in simulation, you shouldn't truncate time. You should try and play it out in real time as much as possible. But you always have to at some extent or another.
There's always a compromise on reality.
Yeah, and but importantly, as long as the learners recognise that, and you do as a facilitator as well, right? Because I've been in situations where I've had to go, that's the simulation. It's not based on your performance. That's just what we often refer to as simulation artifact, right? Or simulation-itis when they're kind of overloaded with it.
Absolutely.
So Helen, the learners in this group, are they exclusively learning disabilities nurses, or is it? So it is just learning disabilities
for the Breaking Bad News. Yes, they're all learning disability nurses.
Yeah. Okay, fine.
Could you see this being more of an interprofessional learning project?
I actually think that it could absolutely be.
If you had an infinite budget,
but absolutely, it's going to be very time consuming. I mean, I don't know what your cohort of nurses are like in your university, but we're looking at 650 students twice a year across all 4 fields. So it isn't going to be something that's going to happen, I think, quickly. But I guess it would be something that could be considered as an optional session if all else fails. But again, I think there's a lot.
Isn't that a shame? Because listening to you, it sounds like it's non-negotiable. You're teaching these skills to be better people, not only better practitioners.
Well, something that you said right early on just really resonated with me and personal experience. You said that most people have some kind of cognitive impairment at some point during their sort of stay. And I remember so clearly when my daughter was born in the North Middlesex Hospital. And at 24 hours old, when neither me or Susie, and particularly Susie, had any sleep or rest, and were massively stressed and tired, they turned around and said, well, you know that your daughter needs to have a BCG. There was no way we were able to give valid consent for an injection for a 24-hour-old baby at that point. And it was, and I've reflected on that many times and thought I was impaired. Like I was impaired. There's no way that was a good, and that was bad news. I didn't want this tiny little baby to have an injection that she didn't need to have, and in the fullness of time. And it was only because of the postcode in which we lived that she had to have that injection. And I've often thought about that. And so I guess this training about this learning experience about encouraging people to recognize ways that they can communicate more effectively, challenging information to people who are impaired for whatever reason, I think is so valuable.
Sure. And I think the important thing is that when we're actually talking about the simulation, there's actually two types of simulation that I'm doing. So the Breaking Bad News is quite specifically for our learning disability student nurses, but I also do a cognitive impairment and communication across all four fields. So this is where all four fields do come and actually have that chance to talk to somebody, form a connection, and they may be, a little bit sort of confused or distracted by what's happening, and we ask them to go and do something nursey, like we ask them to go and do a blood pressure, or we ask them to take an assessment and do an admission. That isn't really the content we want them to do. We actually want them to form a connection. We want them to actually build at some level a therapeutic relationship and trust with that person. And I think that's something that all healthcare professionals at the very least need. I think if we try and change the world, we'd want all people working in any public sector to have those skills. But ideally, really, as nurses and healthcare professionals, not being able to connect with a person really doesn't mean that we're not going to get any sort of healthcare outcome that's positive for that person.
I'm wondering whether there's there's almost certainly people listening to this, Helen, who are like, this sounds amazing, and I'd love to talk to you more about it. Are there contact details for you that we can share, or a LinkedIn profile or something that we can put in the episode description?
Yeah, sure. I mean, I'm obviously at BCU, so I'm Helen.Needham at bcu.ac.uk, as most universities standard email. And I recently have just started to log into LinkedIn. And I think I'm just Helen.Needham at LinkedIn. So I'm sure you'll find me.
Amazing. Thank you. Because
a necessary evil sometimes.
I avoided X, and I'm still on Facebook loosely, but I must admit LinkedIn seems to be the right sort of platform to.
It's good for networking, isn't it? Yeah.
I'm a recovering Facebook user.
Helen, can we, before we start to sort of wrap this one up, can we dip into the potentially spicy topic of ethics in learning disability? Because again, I would imagine it's quite challenging to navigate and to get right.
Sure.
So can you just talk to the listeners a little bit about that?
Yeah, I mean, ethics, I think for me has been one of the biggest challenges. I mean, ideally, I'm a learning disability nurse. I want to work with people with learning disabilities, and ideally I would want people with learning disabilities to come in and be part of our simulation. Unfortunately, I mean, in the past we have encouraged people to come in and support us with some of the simulation, with not very positive outcomes for that person afterwards. I know some of my colleagues are working alongside some of the advocacy groups around bringing people in to support that learning. But I think having had quite a difficult experience with a couple of people who, actually had some quite distressing after effects of being part of our simulation, knowing that we've got some simulated patients who have worked within the field, I feel that gives probably an as authentic as we can experience to our learners without distressing people. And what I really want to do more of, and this is probably where I do want to get more into sort of making sure that we do get the person's voice with a learning disability, is to really talk more to those people before we design those scenarios. So that would be something I would really be keen to do, is really sort of find out, making sure we are doing it right. But I think longer term, I'd really like to sort of start bringing more people in with a learning disability to work alongside our simulated patients, so we could actually do that together. that all comes down to cost and funding and resources and all the other things that we know make simulation and development of simulation quite a challenge. I suppose the other ethical issue for me, particularly around Breaking Bad News, is that I would not bring somebody in with a learning disability to explain something to them in a pretend way. So that would not be ethical at all. So from the Breaking Bad News perspective, that is not going to be an area we could even consider.
Yeah, that's just a massive no.
Yeah, it is.
And hearing you talk about this just makes me think about the limits of simulation more widely, the limits of authenticity and realism, and that actually, there is a point at which it's real enough to give that concrete experience, and sometimes anything more is actually detrimental or maybe just unnecessary.
Yeah, sure.
It's really important, isn't it? Because I'm also thinking how misunderstood simulation is, isn't it? To the uninitiated, and again, we're preaching to the converted with the people listening and watching this episode, but it's often seen as a safe alternative to clinical practice, and it's really not, is it?
And it takes a lot of planning.
In fact, it's probably the riskiest way to learn.
Sure. And it really needs that real fine tuning, doesn't it? And I think that's something that I've been really fortunate that I've been able to fine tune this workshop, and I think it will probably need some more fine tuning as well moving forward. But it's about really making sure that we're doing it in the right way for the students to learn, but to make sure that person with learning disability still has a voice in that. Because for me, there's no point doing it if it's not to improve the outcomes for people with learning disabilities. That's obviously why I'm doing it. It's not for any other reason.
What does the horizon look like for you? What would you like to see happen in the future and with learning disabilities?
Yeah, I mean, I'd obviously like to be doing a lot more simulation, particularly to encourage all nurses, but particularly our learning disability nurses, to interact with people to learn skills that perhaps they're not able to do in clinical practice. Maybe, for this particular Breaking Bad News workshop to be maybe a concept that could be adopted by other universities. I'm not sure I can split myself across the country and go and deliver it to everybody, but to actually maybe be that sort of almost train the trainer, go out and support people maybe on a consultancy basis. I'm not sure how realistic that is. Ideally, I mean, I think I'm just... it's a really strange one because people keep asking me, what are you going to do when you finish your doctorate? And at this moment in time, I'm really not sure, but I think I can see there's lots of little things that are becoming clearer in the distance. I'm certainly not going to be retiring yet. I certainly feel that this is something I still want to pursue and sort of embed into some work moving forward. But where that is at the moment, I'm really not sure. I'm open to offers. I guess is let's see where you heard it here. Let's see where this takes me.
Exactly. Yeah. So if you're looking for a learning disability simulation consultant, we know a really good one, and we can put you in touch for an appropriate fee.
It's so nuanced, isn't it? It's so like you couldn't franchise this and still keep the same level of quality.
It'd have to be a consultancy model.
I think the consultancy model.
There you go. You've sold yourself there.
Yeah, we're in. Right. Well, look, Helen, I think we could talk all night as I think we realised at HPSN as well.
One of the things that we always do to our guests who are currently doing a doctorate is we always ask them to come back and talk about the work they've done once we're past the finishing post.
Hopefully this time next year with a bit of luck.
Great.
Excellent.
Well, best of luck for the write-up and the last 10% of the analysis. And very best of luck. And thank you so much, Helen, for coming on SimCast today. It's
been a pleasure. Thank you so much for inviting me.
You're more than welcome.
And thank you for listening in to this episode of SimCast. We hope you enjoyed it and learned something from it. And we look forward to seeing you again on the next one. Bye for now.
Thanks, everybody. Bye-bye.